This is now a change of topic completely. This is about IVF treatment, reproductive medicine. I'm a specialist and I would like to in IVF, and so this is a little bit of difference now. Coming to the IVF, the reproductive field of medicine, the IVF, or specifically the ICSI technique, was first introduced in 1990, which is about 25 years ago. So, and first of all, it was thought that the male factor would not make a big change, so that the success rates are not related to semen parameters. However, then there were different later publications showing that there indeed is a paternal effect on the embryogenesis, so that sperm does matter. So that is the technique we are talking about. So it's in the reproductive field of medicine, where you get one tiny little sperm of men with poor sperm quality and inject it into the oocyte in order to induce embryogenesis. So now this sperm is injected, and it has been shown that there are two different paternal effects on the development of the embryo. The first is called the early paternal effect, which is mainly due to, or which can be disturbed by factors of the sperm from the centriole or from the oocyte activation factor. And then there is something which is called the late paternal effect, which is due to DNA damage inside the sperm head, either due to chromosomal aberrations or due to DNA fragmentation in the sperm. And this can be seen if you look at the development of the embryo from day one. This is the oocyte, which is then starting division into a 2-cell embryo, then a 3-cell embryo, and then it gets into a more complex embryo, which is then on day 5 called a blastocyst. So especially from day 3 to day 5, the sperm, the nuclear defects does matter. So there is now the question, when we come to sperm quality, how can we judge sperm quality? And we know that there is a sperm analysis due to the WHO criteria, which has been just revised in 2010. So what we call now a normal sperm sample it only needs 4% of normal sperm in order to be normal. And this is not necessarily a good sperm sample. So therefore we need different tests in order to tell the good from the bad sperm. There are tests for DNA integrity, there are tests for protermination, and there is one specific test, it's called MSOM, which is a magnification of the living sperm. The MSOM technique was introduced 10 years ago. It's a magnification of the sperm, of the viable sperm, up to 10,000-fold to see whether it has so-called vacuolizations. I can show you like a sample. This was the average sperm magnification. If you judge a good sperm, you use a 300-fold light magnification and look at the sperm and say, well, that's looking okay, it's moving, so we just take that one. If you look then in high magnification, you will see there are changes here in the sperm head. And these changes, if you look a little closer, they can be membranous structures or small vesicles, but whatever that is, we know that if there are changes in the sperm head, the DNA integration, the DNA might be fragmented, and there have been lots of studies showing that nuclear or vacuolization of the sperm head is indeed a sign for sperm DNA fragmentation. So that's the idea that if you look at the building of sperm, there is a two-step hypothesis. First of all, there might be something wrong with the sperm so that it gets these tiny little vacuoles. And these tiny little vacuoles in step 2 then makes it more vulnerable to oxidative stress. So, and that is what we're talking about. So in our center, we use that high magnification method routinely. And we divide sperm into 3 classes. Class 1, which is the best suitable sperm, has nearly no vacuolization, so no changes in the sperm. Class 2 might have some, but the sperm is still okay. And class 3 is if you have sperm with abnormal morphology. This is the unit we're working with. This is the report card. So we have a certain amount of class 1, class 2, and class 3 sperm. So now the question is, what can we do in order to get good sperm quality? And the first thing we have to ask ourselves is which factors might impair semen quality. So which factors can induce vacuolization? There is the chemotherapy, of course, certain drugs, varicocele, which is like, which can lead to an increased temperature at the scrotum, but also infections and lifestyle factors. And of course, and that's what we're talking here, nutrition. All of these factors named above have or contribute to a generation or exposure to oxidative stress. So what we know is that all these factors, whatever it is, like consuming varicocele, smoking, pollution, or poor nutrition, increase oxidative stress. So therefore, we checked, and that was like a study which we performed in order to, if we can do something to reduce vacuolizations. Yes, we can do something. We can do something to improve sperm. Of course, we can quit smoking. We can do something to diminish temperature on the scrotum. And then we can do something by nutrition. For example, we can reduce bacterial inflammation. There have been studies with lycopene, which is from the tomato derived, in order to reduce inflammation at the scrotum. We can improve blood flow, for example, with citrulline or arginine, in order to improve the NO donation and therefore improve blood circulation. We can improve antioxidative enzyme activity by improving or giving a little bit of zinc, which is very important for sperm sperm development, or selenium, because it is a very cofactor to the glutathione peroxidase enzyme activity. Then we can look at the mitochondrial function of the sperm, because sperm need good mitochondrial function in order to have a good motility. So using coenzyme Q10 or carnitine. And last but not least, of course, giving just antioxidative supplementation such as vitamin C, vitamin E, glutathione, or the precursor N-acetylcysteine. So we use that, and coming to the study now, there's a supplement with vitamin C, vitamin E, folic acid, zinc, selenium, all these things we just talked about. And we asked ourselves, and that was a study which we done, can a supplement improve the sperm according to vacuolization? Yes, it can. So we have shown that indeed, if you give a specific supplement, the vacuolization will diminish. But the question of the study I'm presenting today is, can a supplement also improve the embryo quality afterwards? So this is what we did. We have had couples, 92 couples performing IVF treatment. They did 2 cycles, the couple, and one where the man didn't take anything, and then a second one where the man had been supplemented with a specific compound. And then we checked for semen parameters, but also to blastocysts or embryo outcome. And now looking at that, it has been shown that first of all, looking at the emsome, like on the vacuolization, indeed, we could significantly show an increase in class 1 sperm. So, and looking at the embryo, we have, there was, even though the women got older from one cycle to the other, so a mean from 36 years up to 38, we saw marked a significant increase in blastocyst development. So embryo development got better only by giving the male partner a supplement. So these are the numbers. Female age were increasing. Usually the increase of female age usually shows a deterioration of embryo development, but instead of that we saw a significant increase in blastocysts just by supplementing the man, and we saw an increase in pregnancy rate and also in ongoing pregnancy rate. Therefore, we can show that a compound antioxidant treatment will, or that gives us a hint that especially the late paternal effects have been improved by supplementation of certain compound. And the conclusion is that giving something to couples who want to conceive may increase not only sperm, but also the embryo quality, leading to a higher pregnancy rate and a higher rate of ongoing pregnancy. So less abortion just by supplementing the men. And this has, we strongly believe that this is an issue which is not addressed enough in RT clinics. I would like to thank my team and, of course, a goodbye from Bregenz.
With a dietary supplement, and do you know a similar effect with a whole diet? For example, Mediterranean diet is rich in antioxidants, and these kind of studies are, do you know, are you aware of?
Yes, there are studies, especially from Meneso, for example. There is a study looking at diets. There was just a recent study published from the Harvard University by Mediterranean, so avoiding, of course, meat and like having high doses of fish or like a vegetable can have similar effect. Yes. Yeah.
More questions? I have one question. Can you put the last slide back?
Yes.
This one. Okay. There is this specific supplementation, fertility plus. I think this is kind of a commercial product.
It is, yes, yeah, but we tried different ones too, so because the problem is you have to avoid too high doses of vitamin C, because they can be detrimental to have too high doses of that.
Okay.
So there are others like Proxeed, then there is Profertile. Some of them have very high doses of vitamin C, and that has been shown, there are studies that it can be detrimental to sperm.
Okay, thank you. Thanks a lot.